Okay, now we're going to insert chest drain. So I have my baby here, and we have a right-sided pneumothorax, tension pneumothorax. So ideally, one doctor, one nurse scrubbed in, and baby should be placed like slightly right side up. You can either put something down here or someone to hold the baby, and then you feel the space, as we said, for neonates, second to third intercostal space. So first rib, second, third rib, you have to feel it, and then, as I said, go just above the rib, not below, because that's where the neuronal bundles are there, so you don't want to interrupt. And first thing you do is you give the lignocaine. So your baby is cleaned with chlorhexidine, 0.5% chlorhexidine prep, or the solution. Clean nicely 3 times, and you figure out the space where you're going. It's again, the head should be up, and it's a mid-axillary line where you are going. Give your local anesthesia, lignocaine 1%, 0.3 ml per kg, just around the space where you are going. So you give on different area a little bit, and then wait for at least 1 minute for that to work. And then you have your the needle. So you got your needle, you figure out where you are going, just about the rib, and then introducing your needle. Excuse me for, we don't have resource for me to show you nicely, but I'm trying my best to show it. So the needle is in. Once the needle is in, so ideally we need to insert 0.5 to 1 centimeter in, 0.5 for preterm and 1 centimeter in for a term baby. As soon as your needle in, you need someone just to hold that for you, and then you are trying to introduce the guide wire. Yeah, so guide wire, again, as you can see the tip, you need to make it stretch like this, and then go in here and slowly introduce the guide wire. So your guide wire is in. As you can see, there is a mark here, white mark. That's where that mark needs to be at the end of the needle. So here the mark is here. So that's where then you remove the thingy. Now the guide wire is in. Once the guide wire is in, you can remove the needle out, but making sure the guide wire is not coming out. So slowly pull the needle out like this and leave the guide wire in. So now the needle is out and guide wire is there. Stabilize that with that. And then now what you want to do is dilate the area around the guide wire. So in order to do that, you need to insert this dilator. So this is the dilator which is going in, and you gently rotate and dilate. You're going dilating. As I said, this is the doctors who do it, but it's good for you to understand, so you're working together. Sometimes, as this is a very rare procedure, nobody know what to do. So you dilate it here. Now the area around the skin around the guide wire is ready for you to insert the pigtail. Now you dilate it, and then what you do, you gently remove the dilator. And again, once you remove the dilator, your introducer, your guide wire is still there. Yeah, so that is there. So you prepare the surrounding, and now you are introducing the pigtail. So as you can see, this is the pigtail, and at the end you can see there are holes. So these are the holes you have. You are trying to introduce all this hole in at least 1 centimeter after the hole ending, like at least 1 centimeter extra. Or sometimes if it's a big baby, you can put 2 to 3 centimeter extra, and try to put a tape there until where you want to insert. So this tip again will go from here